So this is the first completed study in a really new line of work. And I would love this presentation to be informal, and anybody just ask, clarification questions or what if questions. What I'm, trying to do with this line of work, we're kind of establishing first principles, proof of concept, and I want to drive it down the translational pipeline towards clinical relevance. And so, especially among the clinicians, any insight about kind of next steps for this work would be valuable. So let's get to it. All right. Today's Shrier family topics and rehab is supported by a generous gift from Nancy and Marc Shrier. The planning committee members have no financial relationships to disclose. Okay, so today's objectives are to describe expressive and receptive forms of retrieval practice training designed to address lexical processing disorders in aphasia, to define lexical-semantic deficit in people with aphasia from a cognitive neuropsychological perspective, and to discuss the clinical relevance of task transfer, that is a beneficial impact from production training to comprehension performance in people with aphasia. So this work, as I noted, it's the first completed study, and there are many people involved to make it happen. So Catherine Roston, Dan Merman, Krista Duquette. We are currently working on the manuscript for publication, and many thanks also to Taylor, Foley, Adeline, and the Language and Learning Lab for their input to various stages of this project. So just to give you an outline of the ground that we're going to cover, I'm going to start with kind of a little brief history of prior work on retrieval practice effects as they impact lexical access, which is the process of retrieving words in production. In the course of production in aphasia, we're also going to talk about lexical-semantic disorder, which is a receptive deficit that's prevalent in aphasia, but it's much less studied. I will be talking about this first, as I call it, a proof of concept study. So receptive and expressive retrieval practice effects, these effects on lexical-semantic disorders. So different approaches to treatment for lexical-semantic disorders in aphasia. We'll be talking about future directions, and I, again, love your input on particularly future directions, because there's a lot of directions we can go with this. So a lot of my work for about a decade now has been focused on translating from what I think are fundamental principles of human learning that come from a vast literature in psychology and educational psychology, cognitive psychology, educational psychology, that have been studied for well over a century. And these are they've arrived at best practices for how to make learning the most durable and the most efficient. But again, that's in the context of acquiring new knowledge. But because these are fundamental principles that have been shown to confer durable learning across a broad range of domains, I was interested in translating from these principles to explicate treatment for aphasia. And so these principles, I call them the retrieval practice principles. The first, so the goal here is to develop basically a theory of learning for understanding treatment of aphasia, for understanding what are the fundamental experiences, even in existing treatments, that are more or less important for conferring durable change. But also what goes along with this is what's the treatment target? What is the functional deficit? So you need an understanding of the functional deficit and how these particular experiences confer change. So it's a very theory-guided approach to treatment, to understanding the treatment process. So the first retrieval practice learning principle is retrieval from long-term memory has powerful effects on verbal learning and retention, particularly when retrieval is effortful. And so in a number of studies, we have shown that this holds for lexical access procedures in people with aphasia. And I'll give an example of this in a minute. A second principle, that spacing in items trials confers more learning than massing, is another line of work that we've executed. And then lastly, greater spacing or greater lag between items for practice promotes greater long-term benefits. Now in this work, we've elucidated the relationship of these different principles to treatment target of lexical access or word retrieval problems, people with aphasia. Now we're going to focus in on this first principle, but apply it to a new domain of treatment. So I've been telling you about lexical access, word retrieval. So what do I mean by that? What is retrieval practice in the context of a naming treatment in the clinic? So there are two common kinds of treatment approaches when you are presented with a person with aphasia that has naming impairment. And naming impairment is a ubiquitous problem. Almost all people with aphasia complain about the inability to fluently and accurately retrieve familiar, common, everyday words. And these two approaches are interestingly contrastive. That again, these are common treatments that are employed. But there's a key difference between them, I contest, and that I've tested in my research. So the first, in errorless learning, in this approach, you might have an item for practice pyramid, but in this training approach, you provide both the word with the picture at the same time, basically. So, and typically the person with aphasia will just repeat. So you're providing them the word, they repeat it in the context of the picture. Now, the difference, the contrast here with retrieval practice, a common form, what might be known as confrontation naming. So you provide you present the picture, and they are given an opportunity to try and retrieve it. Sometimes they may be accurate, and sometimes they may fail, but then you provide the word for repetition as feedback. And so this is the kind of contrastive treatment experiences, and how we delineate, well, what is the role of retrieval from long-term memory for conferring a specific benefit to naming performance. So I'm going to kind of lay out, this is the general methodological technique or design that we've used across all these studies. And so we start with a very large corpus of items. So in the naming studies, for example, we have this corpus of items that's 660 common everyday objects, as you can see, classes and such. And we present this to people with aphasia twice, usually in different weeks. And then from that performance, we take items that are errorful and we match them into different conditions so that we are controlling for many other characteristics of these items, including errorful performance. So then we can see directly at a later test what is performance on these after they undergo different kinds of treatment. So this is a within subjects manipulation. And so in our retrieval practice treatment, there's many aspects of how we control events between these two conditions. It usually starts with a initial familiarization of the item, then they're given that retrieval practice opportunity. So they are given the picture and they're given an opportunity to try and retrieve it. And then we give them feedback for repetition. Now, again, holding everything constant in the errorless learning or the repetition training, we have an initial familiarization, then they are given the opportunity they see the picture and the word at the same time and they repeat it. And again, holding everything constant, we have feedback. So the manipulation comes down to this particular contrast in this experience. And by having multiple trials, then we can look at the consequences of manipulating retrieval practice or errorless learning on multiple trials for a later retention interval. So this is the retention test. So we bring them back. We've looked at different retention intervals. So this is kind of just to kind of give you a basis for what we generally do in these studies. So what we have found, there's just a snapshot of a couple studies. So this is their naming performance on those later tests as a function of the retrieval practice training or the errorless learning training. And as you can see, at this study, this was multiple trials in a session. And we see that there's a marked advantage for retrieval practice at a 1 day and a 1 week retention interval. When we examined multiple trials of retrieval practice or errorless learning in multiple sessions, and then we probed at a greater retention interval, what we saw is, again, an marked advantage for the retrieval practice condition at 1 week and then 1 month. So this is the line of work on the impact of retrieval practice on naming. And now we want to, I guess, apply or examine the applicability of these principles to a different kind of problem in aphasia. And so lexical-semantic disorders, it's a receptive disorder. It's a particular kind of comprehension disorder. And how I kind of think about this is it's difficulty in mapping from a word to its meaning. So we need to operationalize this somehow. And so in this study, as I showed you, we have that kind of first item selection period. Well, what is the task? How do we identify what items are errorful? So I will show you. So we operationalize this with what I call word picture verification. Also, by the way, because I can't see people. So if anybody has a question, I think it's just unmute yourself and just ask the question. Okay, I don't see any hands up or anything, but it just depends on how I have this thing displayed, I think. So operationalize with word picture verification. So in this task, it took an immense amount of work on the part of Krista and Taylor, but what they developed were 408 pairs, I believe, of, I call these kind of, they're minimal semantic pairs. And what this requires is that on a target trial for the word, for example, here, lollipop, they have to confirm, they have to say, yes, that's lollipop. On a different trial, we give a foil concept and they have to say no on that foil trial. So what this is doing is it's requiring that it's not good enough just to get in the semantic neighborhood for performance. We are able to diagnose here when they make an error in appreciating kind of a refined semantic distinction between two closely related words. So this is the word picture verification task, and that's how we identify our errorful items. So why study retrieval practice effects in a receptive skill in people with aphasia? And I think, in fact, that there's a huge literature to draw on for why this is an important question, because in the psychology of learning and memory, retrieval practice is a known potent technique for the formation of new semantic memories. It's potent for the acquisition of a second language, so mapping from familiar concepts to new phonological forms. It's potent for the development of episodic memories, as well as procedural skills. So its potency across many different forms of learning implies that perhaps it is useful to study this topic for addressing lexical-semantic disorders in people with aphasia. And so what I showed you when I was kind of presenting errorless learning versus retrieval practice in the context of naming, That is a kind of a recall form of retrieval practice. So I give you some kind of cue, and then your task is to generate the target for that cue. So it's a recall form of retrieval practice, but there are receptive forms of retrieval practice. For example, multiple choice. So in multiple choice, you see both the target and several foils, and you have to identify what the target is. So you're not generating from the target from long-term memory per se, but you're referencing it in memory, discriminating it from other options in some way. And so there's a much smaller literature on these receptive forms of retrieval practice. And it's still kind of a debate of how potent these are relative to the recall forms. The recall forms tend to be more potent and lead to more durable learning. But just kind of a, what's the word, not prelude, but just to foreshadow that I am interested in a receptive retrieval practice approach, because these, individuals, if we're talking about individuals with receptive deficits, some of them generally, if they have both production and receptive deficits, they are the most profoundly impaired. And many of them, especially if you get down to the global, they're almost nonverbal. And so, a naming training approach to treating lexical-semantic disorders may not be appropriate for those people. What about a receptive form of training where they simply have to indicate their response in the practice just with a gesture? So I'll be studying two kinds of retrieval practice. Okay, so here is the comprehension or the receptive retrieval practice training. And we're going to contrast within each of these modules. So I have a receptive version and expressive version of training. Within each of this, there is a control training comparison that isolates that specific aspect of retrieval practice. So we can identify, does that mechanism have, a functional impact? So this is the comprehension or the receptive training module. And in the retrieval practice version of this, and please, people, stop and ask questions, because it's basically what we did in the study is run two studies. So it's quite complex. And the paper is quite a beast because of it. So I'd be happy to go slow or answer questions at any point. So in the comprehension retrieval practice, basically we're giving them both the target and the foil, okay? And they need to decide for backpack which of these pictures. So it's a choice, not that different from a multiple choice training. So in this case, if the participant is correct, they'll select that picture. And then it was highlighted with a border to confirm their choice. And then we give them feedback to confirm what was the target and what was the foil. So that is the retrieval practice, the receptive retrieval practice training. It's contrastive learning restudy. Here, what we do is we present the pictures, both the target and the foil and the word, and we identify for them what the target is. Okay, and then we give them feedback. Any questions?
Erica, I might have missed it. It's still in. So this is in patients who have an issue with expressive speech. So
this is in, I'll show you the patient population in a minute, but it's okay, in people. Sure. It actually was, it's people that produce enough errors on the picture word or the word picture verification pretest so that we had enough items to assign into the conditions. And their expressive deficits are on a continuum, really. It's a range.
And Erica, this is John, just a quick question about the choice. Did you have a way to sort of scale how difficult or how closely semantically close the two items are that they have to choose between?
Yeah, we elicited, we did a lot of norming of these items, and we do have, we matched for the semantic similarity of the target and the foil in the assignment into the conditions, but we do have that as a potential covariate for like further investigation. Because one thing that might be interesting is for the items that are the most close, that those might be the most effortful. Was that kind of where you're going with that, John?
Yeah. I mean, I just that in general, the task obviously would presumably depend on how easy or hard that discrimination is.
Mm-hmm. Yeah. So we have both a visual similarity. Oh, I think I have an echo. Maybe somebody. Okay. But we have a lot of interesting variables, and we'll be looking at those to see if those interact with these effects to kind of get at that effortful retrieval question. But also we use them as control variables too.
Erica, can I just double check? You say you had norming not only on the semantic similarity, but the visual similarity?
Mm-hmm. Yeah.
Okay, thank you.
One last question, as long as we're interrupting you. Hi, it's Laurel.
Hi, Laurel.
I don't know if you can see us. We're all a whole group of us together here, which is nice. So, Erica, do you have also any tasks that look at the integrity of semantics aside from the lexical-semantic mapping or the semantic to lexical mapping?
Yeah. So we run
semantics. Yeah.
We do run them through the battery. So we have the camels and cactus test. I mean, we don't, in terms of the selection of the items, it is just this, but we have the neuropsychological characterization of nonverbal comprehension. We have auditory lexical decision. We have synonymy triplets, which is lexical comprehension. We have vocabulary.
No, the reason I asked is just, it's obvious that although pure semantic deficits are relatively unusual in stroke, there are indeed patients who, at least for some categories of objects, have trouble with sort of recognizing and discriminating similar items.
Mm-hmm.
Forget about language. So I think maybe when you get to your analysis, that might be something to think about controlling for.
So, so you mean like particular classes of items, like for example, if somebody has a specific deficit in recognizing instruments or animals,
or not even,
kind of,
more broadly, I mean, we know that there are, we know that action semantics are impaired in left hemisphere stroke. Forget about language, knowledge of objects and their associated actions. So, it's just something to keep an eye on, I guess, is that in addition to a lexical semantic mapping problem, there can also be some semantic deficits as well.
Oh, absolutely. Yeah. So we, in the writing of the paper, it's at this point, we're agnostic of where these training effects localize. I mean, it is a verbal semantic task. But yeah, I mean, some of these individuals, it's refining their conceptual distinctions. It could be refining the mapping. It could even, who knows, in a highly interactive system, it could be lower level. So yeah.
Okay, thanks.
Okay, great. I love the questions. Thank you. Okay, so here is the expressive training module. And it's kind of what you've seen before, what I showed you prior for the production retrieval practice training. They are given a picture and they're given an opportunity to try and retrieve it, to name it, cardinal perhaps, and then they're given feedback. And likewise with the errorless learning, they are given the word with the picture, and then they repeat it, and they're given feedback. So, okay. So I told you about how, I'm interested in the comprehension form of training for people for whom maybe naming training would not be appropriate. But what's really unique about this work, I think, is that there is a literature on lexical semantic treatments, but it's for training production generally. Like there's very few studies that actually are interested in training and rehabilitating lexical-semantic processing, at least in the aphasia literature. And so what we're looking at here is, comprehension intervention for lexical-semantic disorders and a production-based intervention for lexical-semantic disorders. And why I kind of think this is interesting is if you have a person that has a naming impairment as well as a lexical-semantic impairment, but you only have time for naming training, should you do retrieval practice or should you do errorless learning, I guess. So it's about the efficiency. That's kind of an efficiency of treatment question. But we are with this because they are just training, on the targets, as you can see here. They're only training on the targets. They never see the foils during training. And so, in a kind of broad level, does training production generalize to a comprehension task? Does it transfer to a different kind of task? But we also will be asking questions about generalization to the foils in this module as well. Okay, so giving kind of more overview of the design. As I mentioned, we had 408 of these minimal semantic pairs that were administered twice, and we selected the errorful items for a participant. The participants that produced more errorful items engaged in, well, let me elaborate this a bit. Okay, so there were some individuals for whom we didn't have enough items, so we just did the comprehension training module because of its novelty. But there were 8 of these individuals that could participate both in the production and the comprehension module. So here's a module structure. Again, item selection, and then they have a training session. And then they're brought back the next day for the 1-day retention test, where we administer the word picture verification task on those items, as well as a set of untrained items. And then we bring them back the following week, and then, another word picture verification test on those items and the same untrained items. We included untrained items in this task, not in an interest for generalization, so to speak, because I still think there is, generally untrained items are used in these treatment studies, but it can be problematic to infer generalization from improvements in untrained items, because it could just be enhanced familiarity with a task. So we use these as an index against which to measure direct effects of treatments on the items, just to clarify that. Okay, so here's a study goals recap. It's funny how the Zoom stuff gets in the way of what you're looking at. So study goals recap, assess whether production-based and comprehension-based retrieval practice enhance performance on errorful word comprehension items in people with aphasia. And we measure this relative to non-retrieval forms of training and untrained control items. We are looking at the post-training word picture verification accuracy as our main dependent measure at the retention tests. And in the production module specifically, if we do see improvements on the trained items over the untrained items, this is evidence for task transfer. We are also going to look at durability of learning. So in the retrieval practice literature, generally what you find is that at kind of early intervals of probing, like post-test performance, that the retrieval practice condition, the effects are kind of weaker relative to restudy, because the benefits from restudy, you get the target, you get the target information on every trial. and performance is just generally higher early on. But then later what you see, that's when you see the advantages from retrieval practice because of the improvement, I guess the more durable encoding of the information during retrieval practice. So there's a measure in the literature where we can look at that. What you do is you take the correct trials at the early test and see the percentage of those that are still correct at the 1 week test. So it is also on the flip side, can be thought of as an index of forgetting, like how much did they forget? And as I mentioned in the production module, we're going to look at generalization to foils. So to make this concrete, if they do naming training on cardinal, later when they do the WPV accuracy task and they see this picture, are they better able to say no? Okay, so generalization to foils. And what this is getting at is, did we refine their semantic distinction, basically? Because they never see, during production, they never see the foil.
Quick question, Erica. Are the pictures, is it the identical picture of the same entity each time?
Yeah, yeah.
So it could be that they haven't learned what a cardinal is, but they've learned what that picture is, right?
Say that again, John.
Well, in the sense that a cardinal is always displayed in exactly the same way. So whether they have fully recognized the concept of a cardinal or whether they are recognizing this is the picture of the cardinal that you keep showing me, right? So we don't even know for sure that the concept is as general as cardinal, do we?
No. Yeah, we don't. Okay. We don't. I mean, that's always a challenge, in these studies. There's been any number. I mean, nobody's done this kind of study before, but there definitely are naming studies where they look at generalization to different exemplars of the same concept. And generally what you do see generalization, but yeah. We are limited. The resources that went into developing these materials, it just wasn't feasible to develop another set. But okay. So Dylan, getting back to your question, what did the sample look like? So as I said, these, I was pleased in that I was worried that, we would have to test so many people to find enough that produced enough errors to complete the study. And it was almost everybody that we invited, but we went into it with using, people that had relatively low performance on these kind of lexical, semantic, or nonverbal measures. And I didn't put this in here, but interestingly, we did find that 2 of these measures, semantic comprehension, which is the camels and cactus test, and synonymy matching, they strongly were correlated with accuracy, the word picture verification accuracy and item selection. So that kind of gives us comfort that these, this new measure, this new way of measuring semantics relates to these other more accepted clinical measures of semantic processing. But as you can see, these individuals from a range from different subtypes, these are not all the more, Wernicke's.
Erica, it's Laurel. Question. I mean, that's actually fits well with what I was wondering about when I asked earlier. If the semantic comprehension is a nonverbal test and it actually predicts well how people perform on the task, it does raise the possibility that there are semantic deficits apart from the lexical semantic mapping, which is interesting, Yeah, cool. Okay, thank you.
Yeah, and Laura, I don't know because it's, there's the work by Lambaugh and Ralph and how they think about these core semantic deficits is that, he has the argument that it's more an executive control issue. So that's a whole kind of interesting way to go with this is it executive control? Is it dysregulated access?
He distinguishes the sort of classic sort of storage versus retrieval and access, which which is a
how
whole other.
useful is that distinction? Yeah.
Okay. Well, we can talk. It'll be fun to talk
Fun.
about.
Yeah.
Yeah. Thanks.
Okay. So, and then the their naming performance is on a range of severity, as you can see here. But we generally, how we think about this is that their auditory, like their ability to recognize words as words and non-words as not words, and then their phoneme discrimination was pretty good. And their word repetition was pretty good. So we think, because there are kind of these rare cases of like word deafness, and the question is like the lower level peripheral processes to understanding words, what this contribution, but we think it is this population generally is lexical semantic or semantic. So okay. Oh gosh. Okay. It's 43 after. All right. So post-test accuracy. On the left, we have performance in the production module, and on the right is comprehension module. And these differences, these training effects against these are the direct training effects, and we plotted them relative to the untrained. Okay, so this is the direct treatment benefit. And what we see at the 1 day is that we have a significant benefit for errorless learning, but then at the 1 week, we have a significant benefit for both errorless learning and retrieval practice. And in fact, this interaction is significant, suggesting that there was a greater benefit for retrieval practice at the later relative to errorless learning. So that conforms to a larger pattern in the literature. In the comprehension module, as you can see, no differences between the two training conditions, but they're both robust in comparison to the untrained. So, generally these patterns, suggest that we are getting significant transfer from production training to comprehension, and that they're both, I guess, they both lead to discernible improvements, both comprehension and production. So, but there is, again, no difference between the two approaches. So I mentioned the durability measure. What we find with the durability measure, so again, production on the left, comprehension on the right. Starting with comprehension first, there was no difference in durability between the three conditions. And here I have untrained also on the x-axis. But what's interesting is that in the production module, in fact, we did see greater durability of performance, greater retention of benefits from the 1 day to the 1 week in the retrieval practice condition relative to the other conditions. So we're seeing some action of retrieval practice that is sensible in light of what we know about the larger literature. And then finally, I mentioned this generalization to foils. Do we see generalization to foils in the two conditions? We did not for either of them at the 1 day. What we do see is at the 1 week, in fact, now we get generalization to foils, but in the retrieval practice condition. So we take this as preliminary evidence that retrieval practice may actually confer some kind of benefit, enhancing either the distinctions in semantic memory itself or in the mapping between words and meaning. So, okay, so discussion, summarizing the finding. Comprehension training confers a benefit relative to untrained and no additional benefit from receptive retrieval practice. They both seem equally beneficial. Production training transfers to comprehension, and that there appears to be a retrieval practice benefit that's more apparent at the longer retention interval, and also benefits in terms of the retention of gains in performance. And we did see generalization to foils in the retrieval practice condition in the production module. So training on cardinal improves your discrimination of what is not a cardinal, I guess, for the foil. So briefly, future directions. We I'm particularly interested in this new approach. It's a very efficient way to administer retrieval practice. Basically, what you do is you have a set of items and you administer those items for retrieval practice until they reach a particular criterion of accuracy. And so what's nice about that is that you are providing treatment on a per item, per person basis so that you achieve a prescribed level of accuracy. And so you're dedicating more treatment to the items that need it. It's a form of individualized treatment. So this is a large kind of new direction for my lab for a lot of these different treatment domains. And it could lend itself to, examining people with even more profound comprehension problems. Because these individuals that we studied, they were pretty chronic. They were in the I say, moderate to mild range of aphasia. And it might be interesting to study people that are more profoundly impaired that really need our help. And then it's the question of where are these training effects localizing to? It could be weak or noisy connections from words to semantics. Could be in a level of damage to just these central semantic representations or dysregulated control of semantic processes. So it's a big open question about what, how are these training effects impacting performance? And I think in future work, we can get at that question with more individual differences, designs, appropriate kind of a case series, or possibly even comparison to other populations. Okay, so there's the CMA credits again, and we can just have questions and talk about any implications or whatever people like. Thanks.
Nice.
John.
Well, Erica, two things. One, I'll mention that UMI has developed a way of coding or of calculating accuracy in what's remembered, referencing what was learned on earlier trials. So I don't know, Umi, if at some point you might want to talk about that at a level that I can't. But the comment or question that I had, Erica, is there's something that's troubling me about the parallelism between the retrieval example and the production example, which is that it seems to me that in your previous discussions of retrieval practice for naming, you focused very heavily on the effortful piece and kind of conceptualized errorless learning as kind of the zero effort end of the effortful continuum, leading me to believe that some degree of effort matters. When you think about this task, yeah, the task is formally similar, but for you to show me a picture and me to name it, I have to pull everything together all the way from semantics to phonology to utter that name correctly. But for you to ask me whether something is an umbrella, the only response I need to do is, left or right point. So it seems like I just need a fragment of information that distinguishes the two, a much less complete, potentially, representation to differentiate them. And the reason I raise that is simply, do you know whether the intertrial interval even matters much in the comprehension side? That is, I'm just wondering, do people really forget over a few seconds which of those things it was? Because that seems to matter.
So one thing, we're not just requiring that they say yes to umbrella. We also are requiring that they say, when they see umbrella, they say no to whatever raincoat or something. Do you see? So it has to be, that's our measure of accuracy. They have to say, as another example, tent, I guess, versus TP. They see tent, they see a picture of tent, they hear tent, they have to say yes. They see a picture of TP and the word tent, and they have to say no. And that is the measure of accuracy for that item. So it's not, and that's across different trials. They're separated by many, many trials. So it's not just retrieving a fragment that gets you there. But I do see your point that, so yeah, would we be able to manipulate things like, effort? Would it make sense?
In particular, I'd want to see empirical evidence that if you lengthen the intertrial interval, people make more errors on that task, because if not, then it maybe is both versions are essentially effortless learning, because people retain it on one trial and use it for the rest of the task.
So what we find, so far, John, I think I would say that if you ask retrieval practice people, so here's the thing, spacing and lag effects, they hold for all kinds of learning, even errorless learning, even restudy. Okay, so it's not just one continuum, there's two dimensions there. And that's what we have found too, is that even errorless learning benefits from spacing. So it is, I guess, it's an empirical question.
I have a follow-up question from that, or comment. One thing you could do to manipulate effort would be to make the FOIL trials easier or harder. So TENT and TP are super close, require a high level of discrimination, but TENT and CABIN might be less effortful. And if effort is indeed at play here, then you may see less robust learning when the foils are further, semantically further from the right. So that's another way to manipulate that. Erica, I was going to ask another question, which is, I don't remember whether you did a direct comparison of the benefit of the production train module versus the comprehension module. It looked like, with the exception of the effortful retrieval production versus the comprehension training, all the which looked equivalent. More broadly, it looked like the comprehension training was a little better for training comprehension, as you might expect.
As you might expect, yeah. So there are all the differences between production and comprehension. One is, in production, they only are training on the target, and they never see the foil. And there is the similarity in processing in the comprehension module, similarity of that training experience to the test. So it's transfer appropriate processing benefits. So in the paper, I did not make that comparison because we're kind of going after this proof of concept in the modules individually and thinking about the different modules as appropriate kind of for somewhat different patient groups. But I did examine that difference, Laurel, just for your interest. So the 8 people that completed both modules, and we found that generally, the comprehension conditions were, the advantage for them over untrained was bigger in the comprehension versus in the production. But you might expect that for any number of reasons.
Right.
But yep, go ahead.
I have a somewhat different question that's bothered me at different times when I've listened to your work, and I probably am kind of missing something, but it seems to me that you treat a person's performance at a given point in time as if it's static. So I get this word today at 1 o'clock, and it's in my, my good pile ever after, and I miss this other word today, and then it's in my error-prone pile. When anecdotally, my experience is with people that whether they get a word or fail to get a word is much more dynamic and variable at different points in time.
Yep, I agree with you completely. So for our purposes, we need to select these errorful items so that we have experimental power and sensitivity. But we're not making assumptions about the precision, because an item that they get right in 2 tests after training, if I administer another test, some of those items will not be right anymore. Some of them will be right in the first one, not in the middle, and then right on the third. So absolutely, there are different that's how I think about this problem. I think about lexical access as a noisy retrieval problem, and not, these items. I think they're, it's about activation levels and learning in the weights and noisy retrieval. I absolutely agree with you. yeah, we're not remediating these items forever. and yeah, they're going to be sensitive to the fluctuations that people with brain damage have in their processing efficiency. So, John, you still have your hand up.
Oh, no, sorry. No.
I think Sharon has a hand up, but if not, I have a question.
Aaron has a question too.
Sharon? You're muted.
Sharon or Aaron?
Sharon.
Okay, I'll go. So I have a comment, I get, or an observation, I guess, and then a question. So as you're describing this, I completely agree with you that there's a real dearth of evidence for treatment for people with semantic deficits and more severe aphasia in general. But another thing that occurs to me as I'm listening to you is that this could have some nice applications for people with progressive aphasia. Yeah. Particularly the semantic variant. It could be a nice, so if you think about, if you're familiar with Jamie Riley's lexical maintenance training, this could be a really nice kind of adjuvant to that, or even a phase 2 of that. So once the person has become so severe that they're not, that they're not able to do the feature generation, et cetera, this could be, either a way in at a point in time when they're more severe, or a nice way to continue practice. Yeah. As the person declines on that set of pre-chosen functional items.
Yeah. So we're always kind of, Krista and I have long been talking about expanding our inclusion criteria so we can study the progressive disorders. So if you have anybody come through the aphasia center that you think has a semantic PPA presentation, maybe we can recruit them. I don't know, but yes.
So should I save my other question for after Aaron has his turn?
I don't see Aaron here.
Oh, okay. Maybe Laurel said Sharon. So my question kind of relates to that also. I'm wondering if from a clinical perspective, you see a path toward kind of, once you've gotten some of the answers you're looking for from the experimental control and manipulation of covariates, et cetera, if you see a path for this treatment wherein people could be working on personalized functional items.
Absolutely. Yeah. Yeah, very much so. I think that would be a great direction code, because it is a semi-consistent problem, or I have to argue to reviewers and grant reviewers that, look, if they have a really small functional vocabulary, it is valuable to give them another 25 items or 50 items. And so why not just, make treatment most efficient so that they have a vocabulary mastery that's personally important to them. And so in our other work, we are developing, this naming app that uses voice recognition so that they get feedback online and stuff. And we're taking these principles and designing treatment for maximal efficiency. But that is definitely a direction we need to go, that I want to go, about different modules of selecting items. And we have employed that in earlier forms of the apps that we've been developing, but it's something we need to circle back to, I believe. You think that would be very valuable too, as well, to people? Yeah.
Yes.
So especially for motivation and their use of the treatment has to be, it would increase their tolerability, I guess.
Absolutely. I mean, I think that their personal relevance has so many dimensions where it contributes to, as you say, interest in practice, investment, to generalization, to, there's so many factors. Yeah.
It seems like it interacts a little bit with one's current notion.
But Aaron has been trying.
Oh, sorry. I thought Aaron wasn't here.
There's Aaron. Okay, I didn't.
We're here.
Gotcha. You're in the milieu there.
Yeah.
Yeah, I'm in the bigger meeting. So I guess I had a clarification question, and then depending on how that answer went, possibly another follow-up. I might have missed this, but is your FOIL item always the same for a given item for each person? So I know at the end you sort of commented that people are learning also what is not a particular item, but that makes it's really hard to say that because they only ever experience one FOIL, versus if you had a lot of different FOILs, then it really makes it more clear that people are learning sort of a broader semantic thing about this is the thing and these are all the things it's not.
Mm-hmm.
So it seems like it'd be helpful to include lots of different kinds of FOILs against the same item.
Yeah, I think that would be a more robust training, but for experimental control, we just had to do it this way. But again, they don't see the FOIL at training during production. They never see it.
Right, but in your comprehension test, they do, right? Because they always get the
no. But they do in the comprehension test, but the index of generalization is measured relative to the untrained items. So whatever that episodic component that might be going on, I think we're controlling for that because it's against the trained items. So
I guess you'd have to ask, like, is it not all of the untrained items to really know, right?
Yeah, maybe we can talk about it. I'm not sure, but yeah.
Okay.
So.
All right, thanks.
John, you still had a question. Oh, he had to leave. So anybody else? This was fun. Thank you, guys.
Thanks, Erica.
All right, I guess we'll.
Thank you, Erica. It was awesome.
Thanks, Erica.
Hey, bye, everybody.
Bye.